All right. Good morning, everybody. Hello there. My name is Susie Jackson, and I'm in North Carolina. And I want to welcome you to our call today. We're going to be talking about a company called Prife International, who is the inventor of a patented technology. And that technology is portable terahertz frequency therapy device. That's a mouthful. But I'm excited. I have my friend May on here, who is the one who told me about it. I was very, very skeptical. Didn't think I needed this until I had an injury to my arm. I'm a tennis player, and I was not using it regularly because I didn't educate myself. That's why we're here today, to educate you so that you will want to use this every single day. But when I had that injury, I was blown away that I used this device on that injury for 10 minutes and I was 85% better. I mean, I don't even expect you to believe that because it was just so incredible. If I hadn't experienced it, I might not believe it myself. But, when you've got quality products and we're talking about the future of healing and the future of self-care therapy, this is big, and we are all at the right place at the right time and able to share this. Our speaker today is Dr. Stanley Lang, who is out of Pennsylvania. And he was one of the first people that I shared this with a couple of years ago. But Dr. Stan's personality is that he, as a medical doctor, he takes what he does very seriously. And he doesn't promote or share anything that he has not fully researched himself and experienced and found to be effective and safe. And so I know he will talk about that today because that's the type of integrity that this man has. So he's been a physician for 46 years. During this time, he has been a pioneer in developing holistic care, along with, working in his medical practice, bringing the wholeness to people, treating the whole body, and especially focusing on the reversing of chronic stress. And he has done this with his patients and with his family. He's created several online programs because he is a giver. He is a giver. He's very passionate about Lyme disease because he has had to deal with it personally, menopause, and helping create the happy, healthy child. So Dr. Stan is going to have a lot of great stuff to share with us. So I'm so excited. Dr. Stan, are you there?
I'm here. Can you hear me?
Yes. Yes. So I'm going to turn this over to you because you just have a phenomenal way of talking to people so that they can. You're so brilliant. He is so brilliant, but he has a way of talking to us who don't have the brilliance. So anyway, I hope you have a pen and paper handy, and I'm going to turn this over to you, and hopefully we'll have some time at the end for some questions and answers. So just hold tight to that. All right, Dr. Stan, it's up to you, darling. Thank you.
Thank you for that introduction, Susie. I'm not brilliant, but I'm very curious. So I follow things that I'm curious about. And but I would like to start this by reading a scripture. I got Susie's permission on this one before. That struck me yesterday. It's from Job, which is an Old Testament scripture, and this is what struck me with it. He has just had his encounter with God after he has been complaining for 40 chapters of the book about his life. And then he says, "I am the man who obscured your designs with my empty-headed words. I've been holding forth on matters that I cannot understand, on marvels beyond me and my knowledge." And then he further repents about his arrogance. And the reason I wanted to share that is because I think that a lot of times I mean, I was challenged by that too. How do I obscure the wonderful design of God, and how do I reveal it? And that's what I want to help to do today, is reveal what I understand. But to say at the same time, this is so complex, nobody really understands it completely. And so what I have done is to attempt to see the bigger picture by looking at different parts of the research and then connecting the dots. So I draw conclusions from connecting dots when the whole picture isn't there. And because this is an area in medicine, which is my area of interest, that hasn't been researched heavily, the whole picture isn't there. So what I'm going to be sharing with you is my best effort to understand that picture, and hopefully it'll be useful to you. So as Susie mentioned, I have been interested in alternative strategies, mainly for pain relief, for a long time, because I personally had pain from injuries. I see lots of patients with those issues. And so that's actually why I was most interested in when Susie first explained this to me, because of the pain relief that she was experiencing. So today's discussion will focus on a particular kind of the body's issues, which we would call neurological issues. And I'm going to talk a little bit about the peripheral nervous system, which can, when it goes wrong, we call that a peripheral neuropathy. And I'm also going to talk a bit about the brain. And the brain, of course, has lots of different issues that we can have. We can have memory issues. Dementia is one of the biggest concerns that people have. The question is, does this technology that Susie just introduced, does it help these things? Can it help these things? And if so, how do you use it so that you can best benefit from it? So I'm going to touch on those things. Before I get to those issues, I want to kind of review a little bit about why this works in the first place, what the device is, and why it might work. And so when Susie first shared this with me, she was saying things like that this puts out an energy called Terahertz that vibrates at the same frequency as cells vibrate. Well, I've studied cells a long time, and I'd never heard that statement before, so it's a pretty mighty claim. And I've spent 2 years trying to understand what that actually means when you say that. And not long ago, I came across research that actually explained to me why you can say that. So terahertz is the frequency of energy, of light energy, that is in a particular range that we call the far infrared. So when I looked for research on terahertz in medicine, I didn't find much. But when I searched for far infrared, then I did find a lot of research on that. And that's how I started to connect the dots. And I finally figured out that the terahertz blower is actually a far infrared device. Now, what we don't know about the terahertz blower is proprietary. We don't know exactly the frequencies of the far infrared that are in it, but what is coming out of it is far infrared. They've analyzed that in a lab, and we have some other evidence that that's what's coming out of it. So when you look at it and you say, well, this looks like a hairdryer, it does look like a hairdryer, but what is coming out of it is quite different than just warm air. And I've been able to do some demonstrations in my own home to prove that it's quite different. There are ways that you can measure the energy coming out of it that we're not going to get into today, just asking you to accept on face value that there is actually a true energy coming out of it, and it's in what we call the far infrared range. So if you look at the visible light spectrum, on this end, we'll say is where the ultraviolet starts to happen, which is invisible. On this end is where the red is, and then just beyond that is infrared. Infrared is invisible. The part of the infrared that's nearest to red is called near infrared. The part that's farthest away from red is called far infrared. If you go any farther, you're into what is called microwave. So far infrared, terahertz, sits right on this end of the spectrum just before you get to microwave, and it has some very unique properties, particularly as it relates to water. So what is fascinating about terahertz is that the water molecule itself has different kind of vibrations in it. And where the oxygen and the hydrogen bind together, they rotate back and forth continuously. And the rotational speed is in the terahertz range. It's between like 1 and 6 terahertz. And a terahertz is 1 trillion cycles per second. So if you can imagine this, but you can't imagine this. The problem is I can't imagine. Pardon me, there's somebody in here that's kind of causing a distraction to my thoughts.
It's been silenced.
Okay, thank you. So it's very hard to imagine things that rotate 1 trillion times a second, but that's what water is doing. That every water molecule in your body is doing that. So when extra terahertz energy comes to this water molecule, it's able to absorb it because it's just wraps it into that frequency, but it can rotate more vigorously. And we can measure the energy coming off of the water that is extra energy. We can also measure when there isn't any extra energy from this rotational stuff. But the reason we can say that terahertz device resonates at the frequency of cells is because cells are mainly water. So the terahertz device literally will be able to affect every cell in the body, because every cell in the body is based on this water is based on being mainly water. Now, last time I talked a bit about how water stores energy. I'm not going to get into that this time, just to say that it does store energy, and that's partly how it gives health to it gives health-giving energy to the rest of the cell by this rotational energy that I've just been talking about. So what that translates into is that for every cell in your body, you can give extra energy to it through the giving of extra terahertz to it. Now, you could go stand in the sun and get some of this extra energy, and I think that's a good idea to do that. But you can give additional extra energy by using a device like the Preif terahertz blower, and it gives a lot of extra energy. And one of the areas in the cell that it gives a lot of extra energy to is called the mitochondria. So these are where the cell itself makes more energy. The energy that it can use is called ATP. And so it's been proven that when you shine or when you expose cells to the terahertz energy or the far infrared energy, that the ATP production increases. So cell energy production increases when you expose that cell to extra energy. And so this device, when you shine it on our bodies, will absorb this energy, and then in the mitochondria translate it into something that's actually fuel for the body. Now, in most cases, when you have disease going on, the problem is that the fix-it system isn't working. it's being overpowered by whatever is damaging the body. And so if you look at any disease, the body has a way to try to fix it, but it can't much of the time because there's not enough energy in the cell itself to be able to turn on the systems that would fix that. So one of the reasons that we see apparent, healing or improvement in symptoms with this particular device and with far infrared light is because it's increasing the energy production in the cell, and the cell can literally turn on its own healing systems. So if you have situations where the tissue has been damaged enough by some disease or by trauma, very often the blood supply has been adversely affected, and so that blood supply is what carries the nutrients, carries the oxygen, and that's all critical for the body making this ATP. Well, if you give that wounded tissue a little bit of a boost so that the mitochondria can make extra ATP from this extra energy, that very often pushes the body back into a situation where it's starting to heal itself again. And that's why you will see so many different diverse conditions get better apparently by using this device. And so people reporting completely different kind of conditions getting better, it's partly because the device is giving each cell the ability to make more energy, and while it's doing that, it's actually supplying extra energy for the cells to store that energy, and so it's not like it's just for the moment that you're using it that you get this extra benefit. You get a sustained benefit because these water molecules absorb this energy and then they release it very slowly into the cell. So you have a sustained benefit that then helps the cell make extra energy. So that, I think, is a big reason why we see improvement in so many different conditions that people have reported. And these are all what we call anecdotes. They're stories. They're not researched deeply, but they make sense once you know how the terahertz, the far infrared, affects the water molecules in the cell, which then supply extra energy to the cell, which supplies specifically extra energy to the mitochondria, which then makes the fuel for the cell. So it doesn't matter what condition you're talking about. That's the mechanism of how the body has extra energy to overcome whatever the deficit is that's causing the disease to win, so to speak. Now, one of the reasons that diseases win is because at the microscopic level, or at least the very small level, the circulation is impaired. And that happens through the disease process. And many, many conditions that we treat as doctors are related to not having enough circulation. And one of the things that the far infrared does is that as it touches on the blood vessels, it actually causes them to release nitric oxide, which causes dilatation of the blood vessel, and you get more blood flow to that area. Now, there's older research that suggests that far infrared works primarily by heating the tissue. And while that is a mechanism, it's not the primary mechanism. It's not just because you heated it up and that attracted more blood supply. It's because you have actually chemically changed the inside of that blood vessel to make more of what it normally makes, which is nitric oxide. And it is able to dilate to its normal diameter rather than being in its contracted state from the disease process. So when you get more oxygen and nutrients going to the wounded area, then the cell has what it needs to fix itself. So we've given extra energy, and Something's just popped up here on my,
I'll take care of that. We need people to help us here and not be,
so are
I'm
you
gonna
still
have
able to hear?
remove you for right now because I don't know how to,
Yeah, I can talk. I just didn't know if I
yeah,
was
I'm
still on.
sorry.
Yeah.
Yeah,
So,
not remove you, yeah.
so we're seeing like a couple of very powerful things happening just with the terahertz to any wounded area. First of all, you're giving the cells extra energy through giving energy to the water molecules. Second of all, then you're affecting the microcirculation by expanding the blood vessels through the natural way that the body does that, which is by producing nitric oxide. And so it expands the blood vessel, lets more blood get to the tissue, and that brings more oxygen, and it brings nutrients, and it takes the toxins away. So all of that can be and is caused by far infrared energy, which is what is coming out of the terahertz blower. So let's apply this concept then to the neurological system. There are two major areas that we see a lot of disease in as doctors, and that I think that this is a device that will be very helpful for people to have for self-treatment. So self-treatment basically is relegated to things that are extremely safe. So generally, governments, including our government, regulates things in a way that doesn't let things that can be potentially harmful or potentially fraudulent into the hands of people that don't know how to otherwise figure those questions out. And so this falls into the category of something that's very effective yet very safe for the average person to use if they follow the basic guidelines that the company makes. So one of the areas that I have a lot of interest in is neurological health. And so one of the things we'll talk about briefly is called peripheral neuropathy. Now, peripheral neuropathy means that the nerves outside of the brain are damaged. And so depends on which nerves are damaged to what kind of symptom you get. So if you damage sensory nerves, you're going to get sensations. If you damage the motor nerves, you're going to get weakness. You can very often both are damaged when you have a peripheral neuropathy, whatever the disease process is. And there are many diseases like this. Diabetes is the most common cause of peripheral neuropathy because the high blood sugars damage the vein, damage the nerves gradually, very gradually, but steadily. And so once they hit this threshold of enough damage, you will start to feel the typical symptoms: tingling initially, maybe numbness, but eventually moves on to actual pain. And for many people, they live with miserable amounts of pain for the rest of their life. And so that's what a peripheral neuropathy feels like. So I came across this research that was a rodent study. They don't do these kind of when you hear the research, it'll be apparent to you why they don't do this on humans. But in this rodent study, they actually severed one of the main nerves to the lower extremity called the sciatic nerve, and then they sewed it back up so that it was attached. But internally, it wasn't. I mean, they had interrupted, the way that the nerve would conduct downstream. And then they had three groups. One was a group that nothing was done, the control group. The second was they cut the nerve and they did a sham exposure to the far infrared device. And the third group were rats that had the same thing that happened to the second group, except they were exposed to true terahertz far infrared energy for 8 weeks. Now, what the research showed was a dramatic improvement in the rate of healing of the nerve. So when you cut a nerve, fortunately, it will try to heal itself, but it heals itself very slowly. And so the far infrared device rapidly improved the rate of healing of the nerve, and that was very measurable. And one of the ways you can measure that is that the muscles that nerve innervates will rapidly start to get smaller. We call that atrophy. And so the atrophy in the rats that had the nerve severed but no treatment was profound. In the rats that had the severing, there was some atrophy, but not nearly as much as with the rats that weren't treated. And then, of course, you had the control group. What was interesting to the researchers, and wasn't part of the research, but they commented in their paper that they thought it was interesting that the wound that they created to cut this nerve in the first place healed much faster in the rats that got the terahertz versus the rats that didn't. And in addition, they also reported that there was a lot better hair growth in that area for the rats that were treated with this terahertz far infrared compared to both the control group and the rats that didn't get any treatment. So what does this tell us? This tells us that all aspects of nerve regeneration were improved by this intervention with the terahertz. So no matter what the neuropathy cause is, when they sliced that nerve in two, it pretty much kills the nerve, except that they sewed it back up so that it could start to heal itself. So many of the neuropathies that we deal with will likely improve, and this is where we get into the speculation part, because this isn't studied a lot. It's studied some, and there is research that suggests significant relief of neuropathy symptoms from far infrared light treatments. Now, this research comes from older equipment that was not portable. So there are devices that have been in the far infrared area of treatment since the 1980s, and some fascinating research from way back then. But they have two things that are quite different from this particular Preif blower. One is the energy output is much lower. Number two is you can't aim it at anything. It's a sort of a global, you put it either on the whole body or a region, and so you can't really target any tissue with it. And so the Preif blower takes a higher energy, but still safe energy, and you can aim it at problem areas, as Susie did when she had her tennis elbow, or her tennis injury to her elbow. And there's another thing that's part of a nerve is called myelin, which is, there are many diseases that cause demyelination, like multiple sclerosis is one of those diseases. And Lyme disease that's infecting the nerves also causes demyelinization. And so what they showed was that the far infrared had restored normal myelin production in this damaged nerve. Now, that doesn't prove that these other conditions will get better, but at least it's a hint to me to say, well, this is something that could very well restore some level of nerve function. And any restoration, even halfway better than where you were, is way better than not. And for most patients that are having enough symptoms that they want to go talk to a doctor about it. So there is a lot of other stuff out there. There's hundreds of studies on far infrared and near infrared treatments that I'm not going to bore you with. I just wanted to explain this one research study, which I thought was extremely well done and had very interesting outcomes that I just shared the summary with you. So that's the peripheral nervous system. The brain is obviously the master controller of the peripheral nervous system. And the question would be, can far infrared help brain health? And the answer is a definitive yes. Now, I want to also mention that near infrared helps the brain, and there's actually more research on humans with near infrared than far infrared. So what I would say is they're complementary. They're different. They have different effects, but they're complementary. Now, what does the far infrared do that's unique? Well, first of all, far infrared is the only part of the infrared spectrum that has this effect on water that I mentioned at the very beginning. So in terms of energy production in the body, one of the things that happens for lots of people is they have brain fatigue, essentially. Sometimes we call it brain fog. We don't really have a good word for what does brain fatigue feel like. Well, it feels like you're walking through mud that's a foot deep, or like you're trying to think through mud that's a foot deep. You can do it, but it takes a lot of effort. And so you actually are able to supply extra energy to any water molecule in the body because of the mechanism that I mentioned at the beginning. So my hunch is that using this device on the head will increase energy production through the same mechanisms I just mentioned, because you're giving energy to water. You're going to affect mitochondrial function eventually in that process, and the mitochondria are what make the energy. Well, if you don't have enough energy, your fix-it systems will not work. So that's the first thing that's different for the far infrared versus near infrared. The other thing that has been shown with far infrared that I think is important to know is that the brain has cells that are actually designed to clean up debris inside the cell, and the far infrared actually activates those cells and helps to clean up debris. We know that for dementia, for Alzheimer's dementia, part of what's going on is an accumulation of protein debris that seems to just get in the way of the normal functions of the brain. So it's possible that the far infrared would help in this area, and there is some research that suggests that. Suggests both Parkinson's disease, which is a type of very specific dementia, and Alzheimer's disease, which is a more global, are benefited by the far infrared. Now, most of this is animal studies, so I can't point to strong human studies because obviously this is literally cutting edge kind of stuff that we're talking about, and it hasn't been studied well enough for me to connect all those dots and say for sure this will help you. But I can say for sure it will have a beneficial effect on your cells, which it stands to reason that can't hurt and it might help. So for anybody that's having any kind of a condition that is along the lines I've been talking about, it would be a true thing to say that this might help, and there are plausible scientific reasons for why it might help. And there are many anecdotes, thousands of anecdotes that says it does help. So anecdotes aren't proof, but they are very powerful evidence that something is true. And for a device that has low risk of damage, some potential for healing, and high potential for benefiting, I'm generally in favor of trying something like that when a person is not completely well. So what about using this preventively? Well, in my experience, if you use things that help the body to heal from a disease and you use them regularly, that helps to prevent disease in the first place. And you can look at any part of the human body, any system in the human body, and look at other aspects of how does the body heal itself. And if you look at nutrition or rest or stress, and you look at using those strategies to heal from something, it's definitely very true that if you use those strategies in the first place before you get sick, you will have a preventive effect. So I'm very confident that this kind of a device, when used regularly, will help the body's fix-it systems be on high alert, so to speak, and be ready, more ready to fix things that are breaking, because our bodies are breaking in many places all of the time. And the body, fortunately, has very robust fix-it systems. Unfortunately, we are increasingly interfering with those fix-it systems. We're polluting the food supply with increasing numbers of chemicals. We have huge amounts of and increasing amounts of EMF, which definitely has a negative effect on cell health. And so we have a good reason to maybe go the extra mile, in my opinion, to do preventive measures that are simple. So why would the average person that feels pretty good use a device like this on a regular basis? Because I think it is a good preventive strategy, and it doesn't involve taking anything into yourself. It just helps the body's regulation systems. So, so I think that there's a role for using this preventively for people that feel very well. But in general, my experience has been if you don't feel well, you don't go seeking for ways to stay feeling well. You just kind of assume you're going to float along, and people generally don't look for solutions until they've got symptoms. But there's a lot of people with symptoms out there. More than 70% of the American adult population now has officially a chronic medical condition, and probably more than 50% of them have symptoms from that. So there's a lot of people that are more in the I got to fix what I got rather than I'd rather prevent what might happen. Either way, I think it's a very useful device. Now, I would like to talk a little bit about how to use it and how I personally use it, because I've made some adaptations that I wouldn't recommend for everybody, for sure. And I'll explain why I made those adaptations, which was that I wanted to figure out a way that I would use it daily, because what I found myself doing is using it occasionally when I had time. And the when I had time is a variable that is not consistent in my life. I generally followed the company's strategies of the different parts of the body to treat, and how long to treat and all that stuff, and to keep the wand moving the whole time while you're treating these different areas. And so I started with my feet, worked my way up basically, and would be moving the wand the whole time. What I've now changed to, and I did this gradually, is that I spend a time in prayer every morning that it's about an hour or so where I'm sitting in one spot. I'm on the floor, and so I can use this device when it's in a holder and just aim it at different parts of the body for a couple of minutes, and then I move it to another spot. And it's easier for me to do that than to try to fit that time in later in the day. And so I combine something that I'm already doing, which I'm stationary. I'm not going anywhere for that prayer time, and I'm pretty dedicated to it. So it happens every day. And so I start with aiming the device at the bottom of my feet, because I'm in a semi-lotus position. So it's easy for the bottom of my feet to be exposed. And then I move up to the knees, then I move up to the groin area and to the lower abdomen, the upper abdomen. But then I skip the heart, because I have an artificial valve that is one of the contraindications to using this device. And I have some other hardware in there because of this heart surgery that ought to not be treated with this, and I'll explain in a moment why. And then I move up to my head, and I do the sinuses, then I do the top of my head. And that's what I try to do every morning. Now, since I have started to do that, I have noticed some improvements that I had not noticed before. I do have a chronic neuropathy from a low back injury that happened about 8 to 10 years ago. And people that know me know that I sit on a very small number of chairs, because I will get symptoms down my right leg within a half a second if I sit on the wrong kind of a chair, which is most chairs for me. And what I've discovered since I've started to do this is that I can sit in chairs that previously I couldn't have sat there for 3 seconds. I would have stood up because the symptoms were too bad. and now it's tolerable. And in some cases, I don't even have any symptoms. So I do attribute this improvement in large part to this process of using this device. Now, before I sit down and start this, I use the device on liquid that I'm going to be drinking, because the water absorbs the energy. And so the protocol that the company has is to wand the water before and after you treat yourself. There's a reason for that. This device is giving energy to the water. We can measure that. I have a way of measuring that, and I can measure when it's there and when it's not. And in another video, I have a demonstration of how powerfully this device will go through material to energize that water. So it definitely gives extra energy to the water, which when you drink it, you can also measure almost instant energy transfer to the body. So combining the treating the water, then treating me, then drinking some more of that water, I think is a very, very good strategy. It's not just a ritual that you ought to do. There's a basis to it. You can measure the effect on the human body. And I know for sure it's had an effect on me for the reasons that I just described to you with this, the sensation in my right leg, this neuropathy symptom that I have, which is a painful neuropathy. And the question might be, well, does it have to be water? And the answer is no. I only drink one glass of water, and mainly the rest of what I'm drinking is coffee. So I wand my coffee. Does it work? Yes, it does. I can measure the energy before and after. So my coffee is so-called energized in this way. This may sound odd, but if you go back to what I was talking about at the very beginning, the terahertz energy matches almost exactly the rotational energy frequency of the hydrogen and oxygen molecule that makes up the water molecule. You got two hydrogens, one oxygen, and they're doing this trillions of times a second. Imagine that. And all you do is supply more energy so that the rotation is farther each time, but still the same frequency. And so as it slows, as that amount of rotation changes, it's giving off the energy. It's like a battery. Every water molecule is like a battery. So this helps me to treat the areas that I can't do it directly with the wand, because the water can get there. So while I can't wand my heart because of the device I said, I can drink the water that will get to my heart. And so I think that is a very powerful reason why that should be part of your ritual if you're going to use this on a regular basis. And I would predict that anybody that follows the total body approach and consumes the drinking of wanded water before and after, that anybody that does that would definitely feel significant improvement within a month, probably within days, but at least within a month. I would predict that. I would be shocked if they didn't. I would be a little shocked if they didn't, because they may be dealing with a disease that the body has to do lots of work on before they start to feel better. And there are such conditions. I would still stick with it, because the body will always be trying to fix itself for as long as you live, until about the last year of your life, when the DNA clock runs out. And so as long as your DNA is replicating, your body is trying to fix itself in ways along the lines that I was just talking about. So using that wanded water and or coffee is a strategy that I do encourage to be part of this process. How long should you spend at it? Well, that's up to you. You should start with a few minutes, because some people have such a healing response that they have a detoxification process that is also called a Herxheimer reaction, when we give nutrients that are designed to detox the body. Well, the far infrared can set in motion a detox system response where you may feel more symptoms because you've got a lot of toxin release that the body's trying to dump, and it's starting to mobilize. And the far infrared will set in motion that process because it's unlocking different kind of healing systems that are sort of locked down for reasons that I've already talked about. So start slow, but work your way up to at least 30 minutes doing that whole body thing, and then aim at the problem part for a while. How long of a while? Well, start small, like a couple minutes, and then work your way up to whatever feels right to you. Pay attention to your body. Your body will tell you when you should stop, and don't go past it. Just listen to your body when it stops feeling well. Avoid going any farther. You don't need to push it, but if your body allows you to do it, it's fine to do it for an hour, in my experience. And there are additional benefits for doing that. But obviously, a lot of people don't have an hour. They don't have 30 minutes. So if you've got 10 minutes, spend the 10 minutes and still try to follow the sequence rather than jumping straight to the problem area. Now, why should we follow that sequence? Because one of the organ systems in the body that is helped by this treatment is called the fascia. Now, the fascia is a very thick tissue that surrounds everything in your body. Every muscle is surrounded by fascia. All of the bones are connected by fascia. The fascia surrounds all of your organs. And the amazing thing about fascia is that it is continuous. It's a continuous sheath. It starts at the bottom of your foot, ends at the top of your head. It doesn't stop. It's just one continuous sheath, and it has the most sophisticated communication system inside of it that are like these tiny tubules that conduct light. They're like, if you look at them microscopically, they look like fiber optic cables. They're capable of moving photons, which are the basic energy package of any kind of light, through the whole system, almost, much faster than the electrical system works. So one of the reasons we can see this rapid transfer of energy from wanted water to a person that has not experienced it before is because the fascia is involved in communicating this information. So one of the reasons I start on my feet is that that's where the fascia is the thickest, but it's also the most available. And so if the only thing you could treat was your feet, that's what you should do, because that will literally communicate with your whole body. So this crosses over with Eastern Chinese medicine strategies, the Qigong, Tai Chi. These are all fascial. From a Western perspective, these are all activating the fascia to be in balance. And so this device is actually helping your fascia to be in balance and communicating well. And that's why you want to hit all these points, because you're helping your fascia to be as healthy as possible, so the body is communicating with itself the way that it does when you have optimal health. When you have disease, you have blockages, and the communication breaks down. And from an Eastern medicine perspective, those techniques are designed to break through those blockages. This is a strategy that breaks through the blockages using light, only it's light that's invisible. It's in the far infrared spectrum. So the last thing I wanted to mention is that peripheral neuropathy, for most people, by the time they have enough symptoms to go to a doctor and seek attention, has impaired, potentially, not always, sometimes it's a motor peripheral neuropathy only, but usually there's sensory involvement. It has impaired the ability to feel when the body is when the tissue is being overheated or damaged in any way. So so using this device and just aiming it at a spot for 2 minutes would not be wise for somebody with a peripheral neuropathy. They should keep it moving continuously, because they cannot feel everything that might be signaling them to say, it's time to stop because this is overheating. So some of these devices feel a little bit warmer than others, but no, even if it seems like it's something that's not real warm to the rest of your skin, you wouldn't want to use it on an area that has advanced neuropathy, because you can't feel if you're over treating it. You wouldn't use it in a way that you just aim it like I do. Like I just aim it for a couple of minutes, then I move it to another spot because I'm reading and I'm writing and other things. That would not be a wise idea if you have a peripheral neuropathy. You would want to keep moving it continuously according to the company's guidelines. With, I think their guideline is 3 seconds or thereabouts in one spot. Other than that, I think you can use it for a long time. You just don't want to aim it at one spot so that it doesn't accidentally overheat and you not feel it. It's very unlikely to overheat no matter what, but just in case, that would be why I would recommend against that. The other contraindication I alluded to, which is that you don't want to aim it at any kind of hardware. Partly, like if you have knee implants, they do heat up faster than the surrounding tissue, and we don't really know whether that would have an adverse impact on the implant connection to the bone. And we don't want to presume that it has no bad effect. So just stay away from those areas. You can still get a lot of benefit by using the workarounds that I described for myself. And with the heart, you've got electronic stuff that you also have to be cautious with, in addition to like valves and stents and things like that. So if you have any of that stuff, you need to avoid directly, and even not real close to the heart, if you have that kind of hardware in it, because we don't know, and we probably never will know, because nobody's going to do the research to prove it. We don't know the safety of doing that. It might be safe, but it's not an area that you want to chance. Now, regarding the brain, how long can you treat that area? You can treat it actually quite a long time, but start slow. Start for maybe a couple minutes, and then over weeks and months you can build it up as you get used to how it feels. And one of the things that I've experienced, because Susie mentioned that I have Lyme disease, I definitely intermittently experience brain fog, and this device definitely helps that sensation improve almost immediately and for a while thereafter. So 2 stories that I told the last time, but are both neuropathy stories, and then I'll finish. Which is, the first story is a tooth pain story, and so pain is obviously the nervous system, and a lot of us have pain, and so I was interested mainly in the sinuses because I have interest in strategies to treat chronic sinus infections and to prevent chronic sinus infections. So I was playing around with using it around these maxillary sinuses, and definitely you can feel a difference if you aim it at the maxillary sinus. After a while, there's something going on in there. But I had a broken tooth on this side that was hurting like a tooth that usually needs a root canal if you want to take the pain away or have it pulled. I'd seen the dentist, and he'd evaluated it, and he said that he had no solution because it was cracked all the way down to the root. So there was no way that it was going to be fixable from a dental perspective. His only solution was to pull the tooth, which I decided it wasn't hurting me that bad. And so, but it was hurting me intermittently. And once I started doing this wanding around the maxillary sinus, where the root canal goes right up to and sometimes into the sinus, within a few weeks, maybe days, but at some point I realized that the tooth pain was gone, and I had it for way over a year. So within days of using this wand, not even aiming at the tooth, I was aiming at the maxillary sinus, the tooth pain went away, and pretty much it stays away. Every once in a while it comes back, so I would say it's 95% better. 95% better in pain is a win, is a big win for me, for myself, and for any patient that I might be treating. The second neuropathy story I want to share is related to this a story I told about our dogs that had Lyme disease, and I tell this story again because one of the one of the accusations that might be leveled against people that make claims about this is that it's all a placebo effect. And placebo is very powerful. The brain can make things happen if you believe it strongly enough. Even if you don't believe it strongly enough, but you kind of think it might, the brain can make it happen. And placebo effect can be as much as 30% in anything. And so we had, on 2 different occasions, dogs that were infected with Lyme disease, to the point that the one dog, the back half of the was paralyzed. The other dog was completely ill from it and was dying at the time that I decided to use this device on her. And for the dog that was paralyzed with the back end, you could treat her for I would say 30 seconds, and then she would get up and start walking. Now, that didn't, I tell that story for 2 reasons. First of all, dogs do not have placebo effects. And second of all, she didn't like how it felt. She wasn't sitting there saying, give me more. She tried to get away from it. So as soon as she could get up, she'd always walk away. And so that points to neuropathy. Often, the nerve is not dead. It's just damaged. It's malfunctioning. And we think, I think there's evidence that 60 to 70% of neuropathy, the nerve is not past the point of repair. We don't know. There's no way to do a test on any particular person. But if you have neuropathy, this might help you because the nerve may not be beyond the source, the range of repair. And the other dog was literally dying. And so I thought, well, we got nothing to lose. We tried this. So I did this device on her for about, I'd say 20 minutes, her whole body. And she'd been laying in a bed for 2 days, hadn't eaten for a couple of days. And literally 30 minutes later, she gets off of her bed, walks over and drinks water and eats. Now, that was not a placebo effect either. And that was neurological stuff going on. It was a lot more complicated because Lyme disease affects everything in some individuals, but it definitely affects the neurological system. And so I tell those stories because it's not placebo. It's beyond placebo. Obviously, believing in a good outcome always is helpful. Of course that's true, and you want to do that. You want to structure your mind so that you're expecting good things to happen. But if good things happen, it's not because you hoped it would happen. This is beyond placebo, as other people that have pets would easily tell this probably even more dramatic stories. But those 2 stories with those dogs will stick with me probably forever because they were so dramatic. So, Susie, that's it.
Wow, you are so amazing. I mean, just I'm going to go ahead and stop the recording. Let me just thank you, Dr. Stan, for all that you shared with us.